Hey everyone, I'm still here, though school has been pretty busy over the past few years, so please excuse my approximately 2-year-long absence from video making. Anyway, I'm still around, I'm still an atheist 6 years after coming to the conclusion that I am one, and no, the various attempts by YouTube theologists, evangelists, and preachers have not convinced me otherwise. And no, I'm not 20 anymore. I'm not a college undergrad anymore, as the people who love to comment on my Why I Became an Atheist video keep assuming when they don't notice a video was posted in February of 2008 when I was a college junior. Anyway, today I want to talk about how I, as an atheist, view death and dying, since I don't see that talked about very often by YouTube atheists. I have a somewhat unique perspective into death, as I've spent a fair amount of time dissecting human cadavers as part of my education, which I'll discuss in detail in this video. So, if you're squeamish or don't want to hear the gory, very graphic details, you might want to stop listening to this video or flip to the end when I stop talking about this and go into my thoughts about death and dying in general. So, here's where I'm going to start talking about cadaver dissection. I've had the privilege of working with human cadavers as part of my training to become a physician. It's one of the most jarring, life-shaping experiences I've had so far. Once you get past the strangeness of it all, it's actually quite fascinating, but I continually found it very difficult to detach myself emotionally from the fact that I was touching, deconstructing, and often unintentionally destroying parts of a formerly living, breathing human being who had thoughts, dreams, hopes, and who loved and loved people who are still alive. I don't think the emotional experience of dissecting cadavers is easy for anyone, but maybe it's easier to go through the experience of dissecting a cadaver if you believe that the body that you're working on is just an empty shell of a person or a spirit that lives on in some afterlife, and you can console yourself with that belief. For me, as an atheist, I don't believe in an afterlife, so these bodies lying on the gurneys represented the end of these individuals who had selflessly chosen to donate their bodies and delay the cremation or decay of their bodies for approximately 2 years after their death. Many of the cadavers in the lab that I worked in came from elderly people, men and women in their 80s and 90s, whose bodies already showed signs of breaking down. Degraded joint capsules, tubes sticking out of orifices, pacemakers, hearts with rearranged vasculature due to previous coronary artery bypass surgeries, lungs that felt like deflated balloons when you pressed on them, a result of chronic obstructive pulmonary disease, and necrotic tissues that had decayed due to metastatic cancers. However, a few of our cadavers came from middle-aged individuals. The cadaver I was assigned to dissect was a woman from who was my mom's age. When I dissected, I had to consciously steer my mind away from the thoughts about this woman's potential spouse, children who might be around my age, loved ones, and so forth who might be missing her terribly, and my own fear about losing my mom at some point in the hopefully distant future. I'm normally lucky to have good interrupted sleep and wake up without remembering my dreams, but during the year that I dissected, I had a lot of cadaver-related nightmares and difficulty getting restful sleep. So, what's it like dissecting a human, you may ask? Well, here's my very graphic, very detailed answer, so stop listening if this is going to bother you. You're given a series of tools to use. A scalpel, which no one has taught you how to attach and detach blades on, so you end up going to YouTube to figure it out. Sharp tweezers, scissors, and pointy probes. And then you're told to start skinning. Rather than the easy way of skinning, removing the skin and superficial fat and fascia to get down to the deep fascia and underlying muscles, you're told to do it the hard way, literally peeling skin to retain the superficial fascia and accompanying veins and cutaneous nerves, which provide sensory sensation to your skin. Different bodies had different degrees of wetness, which was due to the embalming fluid the bodies were soaked in. The body I worked on was very wet, so peeling her skin was like peeling a wet, juicy mango, except that embalming fluid smells terrible and numbs your fingers as you keep touching it, even through latex gloves. All the skin would then go into a common biohazard waste bin to be cremated or otherwise destroyed, along with the skin and fat from every other cadaver in the lab, because essentially all that's left of the cadaver at the end of the year when you're finished with it is bone and muscle, which is cremated to yield ashes of only bone. Anyway, after you've skinned your cadaver, you pick away at fat to uncover nerves and veins. Or, for large sections of fat or glandular tissue that aren't of particular interest to your instructors, you just chop it off with your scalpel and dispose of it in the common waste bin. This was the fate of my cadaver's breasts, which we were told to get rid of on day 1 of dissection, and this kind of bothered me. It felt like we were defiling and dehumanizing her by doing this, but it was all for the purpose of education, which in this case was exposing the pectoralis major and minor muscles which underlie the breast glands, which incidentally can be partially or completely removed in radical mastectomies in women with breast cancer. So, back to the dissection itself. Most of the fat cleaning is done using your tweezers so as to identify and preserve cutaneous nerves, which are as thin as a thread, clear or whitish in color, and have high tensile strength. For some nerves, trying to uncover them was like trying to find a needle in a haystack, and there were a few that I never found, but spent hours digging through fat in search of. Veins were large and easy to find, but somewhat difficult to clean. During my lower extremity dissection, I broke my cadaver's great saphenous vein, which goes up the medial or middle side of your leg, and dumps into your huge femoral vein via the great saphenous opening. Long story short, my glove got covered in clotted up blood, which was another reminder that I was working on a formerly living human being. When trying to get through the dissection, I had to keep telling myself that I was not dissecting a human being because I was trying to detach myself from the subject matter. The two most difficult dissections to get through emotionally for me were the head and perineum, or external genitalia. It felt like a violation of these people's privacy to be cutting up and probing their private parts. I guess in this part of the dissection, the men had it worse, since most of the cadaver's penises were cut in half either vertically or horizontally. A few of the pelvises were hemisected or cut in half vertically so that we could take a look at the inside of a woman's uterus or the male prostate and bulb of the penis. Finally, we dissected heads. The calvaria, or tops of the skulls, had already been opened to remove the brains, and it was somewhat unnerving to look inside the cranial vault and see just empty space and all the cranial nerves we had to identify exiting the cranium through the various fossae, which we also had to know. Thankfully, I didn't have to skin any of the cadaver's faces, but I spent a lot of time staring at these dead people's faces to learn the muscles of facial expression and identify the branches of the facial and trigeminal nerves, to Zanzibar by motorcar anyone, which made it pretty easy to tell what these individuals had looked like in life, and that was kind of unnerving and uncomfortable for me. The last few weeks of the head dissection resembled a horror movie in some part, with some of the cadavers having their heads cut in half longitudinally, some having their tongues and throats ripped out so we could see the muscles of the pharynx and voice box, and a few of them were practically decapitated so we could get a different view of the pharyngeal constrictor muscles. One of the most graphic memories I have is studying one of the cadavers who had been practically decapitated with the top of her skull and brain removed, so you could literally move her face down to touch her chest due to the cut made through her glenooccipital joint with her head attached to her neck only by her trachea and some neck muscles. This was definitely worse, in my opinion, than the limb and finger detachments from earlier in the year. Despite the weirdness and often disturbing nature of this process, dissecting these cadavers and coming face to face literally with dead people on an almost daily basis for a year led me to reflect on death quite a lot. I don't believe in an afterlife, and I don't believe in the existence or persistence of tangible or intangible souls or spirits of a person that exist outside their physical bodies when they die. I do believe that the deceased live on in the memories and shape the lives of the people that they've touched during their lives, just as this group of cadavers have shaped my life and the way I will treat my patients when I eventually finish my medical training. I'm very grateful to have had this experience, even though I would much rather that these individuals who I dissected and spent countless hours studying were still alive and enjoying life with their loved ones. I think about the families of these individuals a lot, and I hope that they're not suffering too much and they can focus on the happy memories they have of their deceased loved one. If those of you still listening to this video have had family members or friends who have made the selfless decision to donate their bodies to science after they've died, Please know that their gift was very much appreciated and has a tremendous career-shaping impact in the lives of many current and future healthcare providers. And for the record, I don't fear death or dying, although I don't seek them out either. I don't know when I'm going to die, whether it's tomorrow in a car accident, 10 years from now from some ultra-virulent infectious disease I catch from a patient, in 30 years from cancer, or if I'm going to follow the trend in my family of living into my 90s in good health. As long as I'm still able to enjoy a good quality of life and am mentally sound, I want to be alive, even though life and living aren't always easy. My idea about death is that you lose your consciousness and self-existence and essentially stop being. It's not something I look forward to, but it's the inevitable end to life that no one can evade forever. The Christian idea of an afterlife where you reunite with every family member, friend, and pet who preceded you in death, or those who followed the appropriate belief system and then preceded you in death, is certainly attractive and comforting to many who are missing their loved ones dearly and don't want to eventually lose themselves when they die. But the way I see it, the afterlife isn't a guarantee. All that you're guaranteed is this life, and time is your most precious commodity. So don't waste your time or your thoughts on things that aren't worthwhile. Make the most of the time you have in the present, because the future is never guaranteed.